My parents hadn't had insurance for a number of years after my mom had lost her insurance at work, and so for about a year, my mom had something in her throat. It was kind of bothering her.
I work full-time, but a courier is not a high-paying job. And so I do fit the parameters for St. Mary's Health Clinic to be eligible for their assistance.
Because of my job, they do provide insurance, but they only provide 51% as the state guideline, and so it gets pricey for a family of 4.
I was working and I have an insurance covered, but after they cut the employers, I lost the job, I lost the insurance. Where you gonna go if you don't have a coverage? Many times I look to my husband, I don't have a coverage anymore. If he's gonna be sick, where I be ending? I don't have it. But pray and say, Lord, please keep us healthy.
In August, she had a bad cold, and we didn't have insurance, didn't know where to turn to, and so I called Bloomington Public Health, and they were able to direct me to St. Mary's, and we went in, and it didn't turn out to be a cold. It was something completely different.
I'm type 2 diabetic, and I have hypertension, high blood pressure.
The school district thought there was something in Daisy's ear, which is white, and that's abnormal.
My mom ended up having Graves' disease, but the most unfortunate part was that it turned out to be thyroid cancer.
I had a cataract, and he did the surgery, and my eyesight in the bad eye went from 2400 to 2015, and I no longer need glasses to drive.
The doctor came to a conclusion that it was a cyst, and they refer us to ENT.
They were very, let's get you in as quickly as possible. Let's find out how we can help you, make sure that you get checked out as quickly as possible. And then, when something detrimental is happening, they were there to just push you right along.
I couldn't ask for better care, warm, caring. Here's what you need to do. Here's what we can do to help.
If she hadn't come in, then it would have infiltrated the lymph nodes. My mom and I and my dad, we were all it was shocking and scary, but we had that relief that this unknown territory, we're gonna face it, but we're gonna be able to get through it.
Without St. Mary's Health Clinics, I'd be unemployed. And I would not have been able to get the eye surgery that I absolutely had to have to work. And while the people involved donate their time, there are so many expenses involved in running medical clinics, all the tests that are done, and there's never a bill to me, but there's a bill to somebody.
If she didn't get referred to the ENT and she never get the treatment that she did, she would lose her hearing permanently. The school that she goes to, and they're really happy that she is recovering and she is doing excellent in school. She no longer requires speech therapist because she is hearing fine now. I don't know what I would have done without St. Mary's. I don't know any other resource or any other places out there that will help me and my family as much as St. Mary's Health Clinics will have helped us.
It's absolutely true that people fall between the cracks, and that for people in my situation, there aren't a lot of options. The option too many people take because they don't have any other choice is they wait until they're really sick and they go to the emergency room.
If you look at her now to before, she's very different, and she's back to her old self, and she's moving along, and things have gotten back to normal. It was a scary time, but St. Mary's was there, and she's back.
St. Mary's Clinic helped us in the right moment, and Mary is now good, and I am so thankful for them. Thank you, God, for that St. Mary's Clinic help. Thank you so much.